Well, this is an aggressive program designed to prevent and control the spread of mosquitoes. Mayor Jim Faust has been a big proponent of this for the last couple of years, and even really beyond that when he was a city council person. And let me ask you, sir, first of all, tell us about this program that you guys started a few days ago, and how aggressive is it, and what does it involve?
Well, it's really a mosquito eradication education program, and it's kind of multi-pronged. We're going to be depositing briquettes in the city catch basins, at least 6,000 initially, to try to prevent the breeding of mosquitoes in the most common place they might do. In addition to that, the inspectors have been trained, as well as Recreation Department employees will be looking for standing water, and if we find standing water, we will treat that, as well as a potential for a $1,000 fine for anyone who has mosquito breeding places and it's obvious that they haven't taken care of it. We'll probably give them a warning notice, and if they don't take care of it, it'll be a $1,000 fine. So we're going to do everything we can to prevent the breeding of mosquito-borne West Nile virus mosquitoes. Those tend to be the Culex mosquito. They usually come out about mid-August all the way through September, and the greatest potential danger is now through probably the end of September.
It's so important. What would you tell residents out there, because it's so important for them to be mindful of the standing water around their properties?
Well, obviously, this Culex mosquito can actually breed in a little pop bottle cap, and so they have to make sure all standing water is clear, and they have to do everything they can to make sure there is no standing water. Obviously, pools are a big concern, and if they know of some area in their neighborhood in which a neighbor who's not really a good neighbor has standing water and they are breeding mosquitoes, then contact the mayor's office or contact the city's blight line. You can contact 574-4520 or 574-4662, but I want to know immediately, because Warren suffered from the West Nile virus a little more than 10 years ago, and we lost a couple of residents, and I want to make sure that no resident falls ill or becomes a fatality of West Nile. And as you know, in Texas, it's a very serious problem. 10 people have already died in Dallas, and Michigan was #1 a little more than a decade ago.
And just want to real quick point out, this is one of the briquettes that's going to be going out?
Right, that'll be the briquette. The inspector or member of the DPW drops this in the catch basin, and this will prevent the breeding of any type of mosquito in the catch basin, and that's the area where they're most likely to go.
Okay, Mayor Faust, thank you so much. If you just hang on for 1 second here. Again, the mayor here starting this aggressive program to help eradicate mosquitoes here in the city of Warren. We'll have more for you later on today at 5 o'clock. Reporting live in Warren, Kimberly Craig, 7 Action News. Back to you.
Good to see that aggressive approach there. Thank you so much, Kim. So let's take a look at some of the symptoms of the West Nile virus and what can be done about it. And joining us now to talk about this is Dr. Christopher Carpenter, an infectious disease specialist from Beaumont Health System. Thank you so much for being with us today.
Thank you for asking me to come.
So what are the symptoms? A lot of people want to know because they're nervous about it, especially after seeing what happened in Texas.
What most people don't realize is actually about 80% of people who get infected actually have no symptoms.
Really?
Right.
And that's frustrating.
Frustrating, but good, because you're not sick from it.
True.
And the roughly 20% or so get a flu-like illness that's not very specific, so you may get fevers, muscle aches, headaches, things like that, that are tough to kind of say this is from West Nile versus another illness. The less than 1% of the people that they're talking about in the news with people getting sick and getting hospitalized and such.
Okay, from the time you get bitten by a mosquito to the time you start seeing some of those flu-like symptoms, what's the incubation period?
Roughly 2 days to about 2 weeks is when the window period, and the sicker you are, it can progress during that time. You may not feel that bad to begin with, but then get much sicker as the days go on.
And how long do the symptoms last?
Most people recover pretty quick. If you're going to get sick, you're going to be better within a few days to a couple of weeks, but some people, those symptoms and illness lingers a bit longer. Some people have long-term problems from the infection.
And let's talk about some of those long-term problems, because I've heard even paralysis can be caused by this. Obviously, we've heard of the deaths across the country as well.
Well, the reporting data suggests there's roughly 1,000 cases in the United States, but that's just the really sick patients. There's probably 100,000 or so true infections with West Nile this year. So that of that group of 1,000 patients that they've reported, roughly 2/3 of those are the ones that get hospitalized with the meningitis and the encephalitis. And those patients who get sick from that often end up in the intensive care unit, can be on breathing machines and such, and lingering symptoms could be weakness, like you said, difficulty thinking, things like that.
What are the age groups or types of people who are most susceptible to those most serious symptoms?
It can hit, unfortunately, all age groups, but the ones who are most susceptible are folks who are over the age of 50, people who are immunocompromised, they have a low immune system for one reason or another, are at higher risk, and other populations as well that you need to be aware of. So the idea is that if you do get sick and it's a minor illness, probably you don't need to go see your doctor, but if you get sicker with high fevers, bad headaches, difficulty thinking, confusion, that's the time to get in touch with your doctor or go to the emergency center.
What's your favorite mode of prevention?
There's several that I think it's more not my favorite. I would do multiple things. One is getting rid of mosquito pools. You know, any standing water in your neighborhood, you want to get rid of that. Using mosquito repellent like 30% DEET. Long sleeve clothing if you're going to be outside at dusk and dawn. And generally, if you can avoid it, not go outside at dusk and dawn.
There you go. Dr. Christopher Carpenter, an infectious disease specialist from Beaumont Health System. Thank you so much for your information today. We appreciate it.